morning, ma'am and sir. I'm Nolsijan Cisneros, and I'm gonna do the blood. I'm gonna perform the blood pressure, and this is my equipment and my patient. Introduce yourself and verify a client's identity to ensure that the nurse carry out the procedure with correct clients. Si Nolsijan Cisneros, nursing student. Kasi pa nga na to, sir. Nolasco Cisneros Jr. Explaining what you are going to do and why it is necessary. Sir, magkuha tag blood pressure. Perform hand hygiene to prevent contamination. Provide for client privacy, client's basic right. Position the client appropriately. Place in the position unless otherwise specified. Both feet should be flat on the floor because legs crossed at the knee result elevated systolic and diastolic blood pressure. Slightly deflex the elbow with the palm of the hand facing up and the forearm supported and heart level because the blood pressure increases when the arm is below heart level. Make sure the bladder cuff is fully deflated and pump valve moves freely. To ensure accurate and precise reading, locate the brachial artery and the antecubital space with the fingertips. This is to determine the location where the cuff will be placed and the diaphragm. Place the lower border of the cuff approximately 2.5 cm, 1 inch above the antecubital space. Apply the center of the bladder directly over the artery. The bladder inside the cuff must be directly over the artery to compress to ensure accurately reading. Clean the earpiece with the antiseptic wipe and insert the air attachments of the stethoscope tucked slightly forward, ensuring diaphragm hang freely to prevent contamination. Place the bell inside of the amplifier of the stethoscope over the brachial pulse inside because the blood pressure is low frequency sound. With dominant hand, turn valve clockwise to close. Compress pump to inflate cuff until manometer. The dominant hand is associated with handiness and effective connectivity to the motor system. Release the valve on the cuff so that the pressure decreases at the rate of 2 to 3 millimeter of mercury per second. Because releasing the valve is faster or slower, an error in measurement may occur. As the pressure falls, identify the manometer reading and corrective paces. The manometer reading corrective paces is 1, 4, and 5 must be identified to determine the systolic and diastolic pressure. Deflate the cup repeatedly and completely to release the pressure. Remove the cuff or wait 2 minutes before taking a second reading. This is permits enough time for the blood trough in the veins to be released. Record reading provides ongoing data collection and comparison. Inform the client of reading. It is the client's right to be informed of the result. Thank you. Cantiknya